nagbabalik mga kasambahay ang Doctors on TV.
Yes, at para mas lalo nating maintindihan ang ating magiging talakayan ngayong umaga patungkol sa ating mga anak, panoodin po natin ito.
Ang unang buwan ng Pebrero ay tinalaga ng Department of Health bilang National Mental Retardation Week. Layunin nito na mapalawak ang kaalaman ng publiko, lalong-lalo na ng mga magulang, kaugnay sa mga unang palatandaan ng learning disabilities. Batay sa datos ng Department of Health, patuloy na tumataas ang bilang ng mga kaso ng learning disabilities, kaya naman tumataas din ang enrollees na may mga special needs sa mga pampublikong paaralan sa bansa. Inirerekomenda ng mga developmental experts ang maagang detection at intervention upang mapababa ang epekto ng learning disability sa isang individual. Kaya naman bilang pagsuporta sa mga programa ng Department of Health, ngayong umaga, ating pag-usapan ang mga unang palatandaan ng learning disabilities sa tulong ng mga expert. Doctors on TV.
At yan po mga kasambahay, ang topic natin for this morning, Understanding Learning Disabilities. And to help us understand our topic better, we've invited an old friend. Dati na siyang guest sa atin, a developmental pediatrician, ka-schoolmate ko sa Xavier School and sa UERM, Dr. Alexander Herrin.
Hi, good morning,
Good morning,
Jay.
Dr. Jack.
Hi.
Welcome back.
Welcome
Hello
back.
again.
Good to have you.
Hi, good morning.
Yan. All the way down from Malolos, ha?
Oh, yeah.
Thank you for being here. Thank
Lalong
Thank you for
nagiging
having me.
bright, no? Nag-start tayo ng bright yung morning natin. Mas bright pa ngayon. Super young looking yung ating guest. Ayan.
Magkaedad lang kami ni Jay.
Bagay na bagay.
I thank you for saying that. Actually, ahead ako ng konting-konti.
Huwag masyadong...
Ang kapatid dyan, si Dr. Philip Tangatwe na 2 weeks ago guest sa
He was with
atin.
us.
Yes.
Sa mga savior.
Xavier. My son is joining Xavier
Ayan.
ang June.
Congratulations.
Enrollment na ninyo ng April 14. Ayan,
Ala.
sinabi.
Baka isang araw, guest na natin yung anak mo.
O
Ha?
baka,
why not?
mag-guess. Pwede na nga ngayon eh. Nagdi-discuss siya ng heart condition.
Wow, wala sa mommy.
Nagdi-discuss.
So at least wala siyang learning disability.
Wala na siya.
Yan ang magandang pag-aralan natin, learning disability. Kasi napakaraming iba't ibang parang sakit na naibibigay or nababrand sa isang bata pagka medyo tinatawag nga backward. I don't know if that's
Well, okay,
Tama bang matawag siya na backwards? Kasi parang delayed. Oo.
well, ano naman, when I think about it, it's not always about being delayed or being backward.
Yeah.
It's always about having issues and concerns. When you say problems, kasi when you say disabilities, everybody feels so,
Yeah.
diba? So,
Disabled.
Kasi disabled, no?
and it's always about the proper attitude. So it's about issues, concerns, diba? And it makes people a little more at ease pag kinukwentuhan po kayo.
Okay. So ano ba talaga ang learning disability?
Yeah, when you talk about learning disabilities, you usually see this in school-age children or maybe sometimes a little younger where they have difficulties maybe sometimes in the process of learning, meaning reading, maybe writing, sometimes math. It's not simply, hindi ako marunong magbasa. Yung iba, nakakabasa pero mas mabagal o kaya hindi ganun kagaling ang pag-spelling, ang pagsusulat ng mga thoughts nila on paper, and then math problems, both formulaic and yung word problems.
Pwede pang sabihin, Doc, na ay nako, hindi lang talaga genetic yan eh, hindi lang talaga magaling sa math. At 5 years old, hindi pa nakakabilang ng 1
Well,
to 10.
that's usually why you see it in school-age children. That's when by culture, ini-expect natin na marunong na sila. But the difference between, let's say, learning disorder or learning disability and yung hindi lang ganun kagaling is that kahit papaano, one, na ituro ng you have adequate instruction, which means naturo talaga sa'yo, pero hirap ka talaga mag-process, mag-apply, mag-absorb. Hindi yung parang, never naman naturo sa akin yan. That's something totally different.
Okay.
What age do you usually see this in a child?
Okay. Well, usually with learning disabilities, if you want to talk about reading, putting it into written expression, or even math, we're usually introduced to this maybe during the school age. Grade kinder, grade 1, grade 2. And we usually see the patients at around that age. Doc, ayaw niya magsulat. Doc, sa school, nagbabasa, parang hirap siya kumpara sa classmates. But sometimes you actually see this 2, 3 years old. Not in the reading, pero yung tipong when when you read to your child, wala siya masyadong gana. When you talk to them, pati sila, some of them may have language issues, hindi sila ganun kagaling magsalita o mag-intindi. And these are already some warning signs na, bantayan mo yan. Kasi pagtanda, baka mamaya mag-translate yan
So,
sa academic problems.
As early as 2 years old.
You can look out for them na. Maybe you can't diagnose it per se, and you still have to teach them how to read and write. But they do come out sometimes as that way.
So sometimes if they're not interested, pag tinuturuan mo, that can be a sign as well.
Or it looks like they cannot really understand it as well as maybe the other children, the other brothers and sisters
That's
at the
why
same
they're not
age.
interested.
And some parents might be in denial, no? Baka mahina lang
Delayed
siya,
lang,
medyo
oo.
late learner lang to or late bloomer.
Well, ako naman, yes, children develop at different rates. Minsan, mas matalino lang talaga ang isa kaysa sa isa. Pero for me, don't wait. Kasi pag medyo nagdududa ka na, that's when you can do something about it. That's where you should be doing something about it.
Kasi hindi ka magdududa kung wala kang nakikita eh.
Right. And kung hinintay mo lang yan, mas mahirap sabihin na, ay sana mas maaga ako nagsimula.
Oo, sana naagapan.
Opo.
Pwedeng further complications niyan, yung depressions between the parent and the child. Kasi pag hindi sila nagkakaintindihan, minsan may iba kang nagagawa kasi you would always...
Napaprustrate ka
O,
rin eh.
napaprustrate ka eh, no? And we don't want that to happen
Kawawa.
in
Yes.
relationship.
So ano ba yung, may classifications ba yung mga learning disabilities?
Well, usually they're divided into 2 or 3. One is reading. So, kunwari, inaccurate yung pagbabasa o hirap talaga magbasa. Slow rate of reading. The other is putting yung thoughts into written expression. So, spelling, grammar, punctuation. And then the third is math. So, pwedeng math yung usual 3 plus 4, 7, or more complicated processes, or yung mismong word problems. Ang dami mong kailangan i-keep in memory, i-manipulate, doon sila nahihirapan.
Alin doon ang pinaka-common, Doc, sa tatlo? Math yan, no? Math.
Well,
Kasi ako ganyan ako, hindi ko alam kung learning
May
disability.
learning disability kang bata ka?
Hanggang college nga, problema ko yung math eh.
well, I don't really have, exact stats. Pero if you think about it kasi, in our lives, you need reading and understanding for everything.
Comprehension.
So, pati math, may comprehension ka dapat eh. Oh.
Understanding kung bakit 1 plus 1 is 2.
Oo. Or even story problems.
Some
Meron
would
akong
just-
3 puting. Binigyan mo ako ng 4. Ilan ng...
Kuting ko.
Oo.
Okay.
Diba?
Huwag kang magpapautang, Ate Lynn, ha? Nalugi ka.
Tama, tama.
Yung ako negosyo ang magpapautang.
Either yayaman siya ng gusto. Lulugi.
I know. So pagka ganito, doctor, no, may learning disability ang isang bata.
Right.
Of course, the parent cannot really diagnose it right away. They bring the child to you.
Yes.
Ano po yung mga steps and procedures na kailangan pagdaanan ng isang bata kung sakaling dinadiagnose mo na siya
Okay.
kung may learning disability?
Well, when they come to the... Well, you start with the pediatrician, not even a developmentalist yet.
Okay.
No?
Okay.
You come with concerns of difficulty in learning. So, let's say na elevate na sa amin, what we do is we try to assess really saan siya nahihirapan. Ano ba ang history niya? Pati ang parents ba nahihirapan? Meron ba sa pamilya? You usually see this in families, ano? How is the child doing in school? Ito po ba ay inadequate instruction lang? Kakasimula pa lang, hindi pa marunong? Or talagang nakaisa, 2 taon na siya, na ituro, it's expected na alam na niya, hindi pa. What we try to do is, you can't just say na, ay, hindi siya marunong, therefore learning disability or learning problems. We also try to test them talaga and compare them to other children. Kailangan mo establish kasi na hindi talaga up to par dun sa expected sa kanila.
Okay.
Kasi pag siya mong mabagal, napaka-vague nun eh. Di ba? You have to compare it talaga.
Concern na yun.
Standardized
Ah,
test talaga ang
okay.
kailangan nun.